I call the Parliamentary Secretary to the Minister for Finance.
Thank you, Acting Deputy Speaker. And I was delighted to help turn the first sod of soil with Federal Health Minister Susan Lee to begin work on Griffith's St Vincent's private community hospital, marking the beginning of construction of a really exciting and much-needed project. The new $20 million private hospital will include 20 overnight beds, 20-day beds and 2 new operating theatres. This vital piece of infrastructure, which has been talked about for more than a decade, will help transform access to vital health services for families in the Western Riverina. This ensures the community receives the most appropriate care earlier and builds on the Coalition Government's ongoing commitment to improving the delivery of health services to regional and rural communities. Coupled with the educational networks now operating at the base hospital right next door, the community hospital will complement a fantastic local health precinct. The Murrumbidgee Clinical Teaching and Learning Centre will be co-located with the new private hospital, presenting opportunities to train doctors and health professionals locally. The federal government has committed $11.4 million to the project, and $1.2 million has been tipped in thanks to a fantastic fundraising drive by this wonderful local community. And it goes on from a $1 million upgrade to the maternity wing at the public hospital, and an announcement on Sunday by the member for Murrumbidgee and Adrian Pickley, as well as the New South Wales Coalition Health Minister Gillian Skinner, of a new $4 million ambulance station for Griffith. So things are happening in Griffith in the health front, and as the Federal Health Minister Susan Lee said, we have a simple vision for health nationally. It's to stop people getting sick. Preventative health is vital as we move into the next generation, but of course, importantly, once they are sick, to have them cared for in a first-class setting. Put simply, with rural and regional health, my vision is to close the gap. I will acknowledge the previous government promised this $11.4 million for the Griffith Community Hospital. But our government is delivering on that promise. Our government is finding the money to fund it. And along with the local community, and I took part in the fun run, a fun run committee chaired by Councillor Ann Napoli from the city to Lake Wyangan to help also raise funds. And certainly there was another $20,000 tipped in from the fun runs since 2012 to also help this wonderful community project. As I say, $1.2 million, which delighted the Mayor, John Dalbroy, who said it was a proud day for the city. He acknowledged, rightly, the Spagnolo and Casella families for helping to make it a reality. The crowd also heard from St Vincent's Health Australia Board Chairman Paul Robertson, and their contribution, St Vincent's contribution, has been enormous. John Dalbroy said the council has been very proactive in making the project a reality. Indeed it has. Bishop Gerard Hanna conducted a blessing ceremony and said a prayer before the first sod was turned. It was a wonderful day, and it's a wonderful start to a wonderful vision and project for Griffith. Thank you, Deputy Speaker.